Hey guys, this is another mini nursing moment for you guys. So, did you know that timing with some medications is vital? For example, if you are taking a medication on a repeated time clock, say like take metropolol, or let's do something better, take Depakote every 8 hours for seizure precautions, etc. Well, did you know that you should stick with a routine with that? And what I mean with that is a lot of medications that are scheduled need to be taken at that time, and it should not be deviated. So, for example, let me tell you a little bit of a story. My best friend's dad was a traumatic brain injury, okay? He was prescribed anti-seizure medication to help protect him against seizures. Well, the bottle said 3 times a day. The wife was not well versed in English. It was her second language, but she was proficient in it, but she didn't ask the questions of, should I take this on time, the same time every day? You know, she did it 3 times a day, and no one explained to her it should have been, maybe you should take it every 8 hours. A lot of people do not know that some of these medications, when it says 3 times a day, is actually stating every 8 hours. So with seizure medication, just make sure that your patient and the families know that this must be done on a pretty regular basis, because you want to keep the level of medication consistent in their blood or in their body to further prevent seizures. If that level drops, they are more likely to have a seizure. Case in point, the wife, she did not give it on a schedule, but she did give it not every 8 hours. She gave it 3 times a day. It didn't matter if it was 9 o'clock in the morning, 11 o'clock in the morning, or noon. She was still giving it 3 times a day. However, she wasn't giving it at the same frequency. Example, 3 times a day in nurse talk, you would equate that to every 8 hours. But no one explained the importance of this. So they were at a birthday party, a children's birthday party, and her husband suffered a massive seizure in front of the children, and 911 had to be called. He was stabilized. He was fine. Long story short, he went post-ictal and he recovered. But the emotional side effects was really devastating, because this was a children's birthday party and the children witnessed someone having a seizure, which can be very traumatic to someone. So remember, if you are taking, or if your loved one is taking seizure medications, make sure you're doing it on a consistent schedule, following the frequency, whether that is 3 times a day, equating to every 8 hours, 4 times a day, which equates to every 6 hours, and it goes on further from that. So make sure your timing is correct. Make sure you're getting the education and you're providing the education, and check for understanding. Also, I would urge you that if this is not the patient's primary language, you get information from them in their primary or preferred language, so that you know that there is no language gaps. Because what is going to get you in a lawsuit is if there's a language gap, and we don't want that to be a liability. So again, schedules, frequency, and checking for understanding are all vital in this. This has been your nursing moment, mini nursing moment. Check back for more.